if you are if you're going to a very hot area, try and cover up yourself, have a hat, so that you're not constantly exposing your skin to direct ultraviolet light. Maintain a healthy diet, healthy weight, okay? Healthy weight and physical activity, some form of physical activity. And then avoid risky behaviors, safe sex, which means infections like human papilloma virus, we reduce almost to zero, if possible, in terms of getting exposed to human papilloma virus. And then important to know your family history. Understand your family. Every time when you finish when you visit the doctor, they'll always take a family history. Who else in your family may have been exposed to this? And if my auntie has had breast cancer, and this is my maternal auntie, and then my mom had breast cancer, then likely my risk is increased. I'll be more proactive to do my genetic profiling and look at the risk of, genetics is a non-modifiable factor, but technology is there to test. And it's so yes, it's non-modifiable, but you can see that we have advances that are enabling us to even test and modify it now by being more aggressive like Angelina Jolie. All right, so last but not least is I just wanted to talk about the human papilloma virus vaccine, and to know that it's out there. About 85% of the whole population, 85%, if we were to count ourselves here, 85%, sio ni watu wengi, at least you will be exposed to human papilloma virus in your lifetime risk. Okay, and human papilloma virus, it has, specifically for cervical cancer, exposure to it increases your risk of getting cervical cancer by 95%. So, and yet this is something that is preventable. Of course, the only way to prevent, and you saw cervical cancer was number what in terms of the cancers? Yeah, it was number 2, okay, after breast cancer. And that is in our country. And yet there's something that can be done about it. One, of course, is prevention. And prevention means, the best of it is a virgin marries a virgin, and then they remain faithful to each other. That means no lifetime risk of human papilloma virus to either of them. Because even the men can get penile cancer, and they can get throat cancers, and they can get even anal cancers from human papilloma virus. But there is vaccine, and this is a vaccine that you can be able to give. The Center for Disease Control, I'm sure you've heard of CDC. When we were talking about the COVID, CDC came up a lot. And it recommends 2 doses of human papilloma virus for children from the age of 11 years up to 26 years of age. They're assuming maybe by 26 years of age, they are still giving room that by that age, there is still less risk of sexual exposure. Of course, 26 is on the higher side, but they are planning it out that if you're still within those ages and you've not been exposed to sex, then you can get the human papilloma virus. And this reduces the risk of getting the HPV, risk of getting the cervical cancer, significantly. So I think that was my last slide. So generally, it's just to have information on how best we can be able to care for ourselves, how best we can be more proactive about our health, and in terms of if there's something abnormal in your normal body, then you become proactive about looking out what else it could be, because cancer doesn't say I'm here, and like malaria or diarrhea or what, hiyo itakupeleka hospitali haraka. Okay? All right, so thank you very much. I only have 2 minutes for questions because my time is up. Okay, asante sana. May God bless you. Yes. I think 2 questions only. It's okay.
My question is, being cancer is the lead now, you as a government or as a medic, what have you done for the patients to